So they may actually be coming in to see you about a headache problem. And then you kind of go, actually, is there other things going on here? Does your pain come down here? Makes you think about TMD symptoms. 50 to 90% of people will have some sort of TMD dysfunction at some point in time in their life. Dental professionals and those who are looking at facial pain should consider acupuncture and dry needling for TMD and TMJ dysfunction. So on this episode, we're going to be talking about TMJ or TMD dysfunction and how acupuncture and dry needling may be able to help. So there was a national guideline that came out, I'm going to say maybe it's 2023, that recommended that dental professionals and those who are looking at facial pain should consider acupuncture and dry needling for TMD and TMJ dysfunction. So let's look at some of the stats first up, right? It's thought to impact around 5 to 12% of the UK population. And there's a higher ratio of women, it's about 2 to 1 compared to men, who suffer from it. It seems to be that 20 to 40-year-olds are the prime candidates to develop TMD symptoms. And about 50 to 90% of people will have some sort of TMD dysfunction at some point in time in their life, which is absolutely massive. So the 5 to 12% of the population are the ones who have the persistent problem, whereas that kind of 50 to 90%, granted that's a massive range here, obviously includes people who have like something that's just mildly irritable for a few days. Some of the risk factors of developing a TMD dysfunction: bruxism, so that's teeth grinding and clenching of teeth. That's often associated with people who have like a stressful job or something that's stressful going on through their life. Stress and anxiety, like I say, that in itself, so not necessarily an event, but just having that as a diagnosis can lead on to TMD dysfunction. We're going to have people who have like bite alignment problems as well. So that's where there's altered jaw mechanics, and that can then go and lead on to TMD dysfunction. Hormonal influences as well. So there is some suggestion that things like estrogen, certainly when there's fluctuations in estrogen, that seems to be linked to higher TMD dysfunctions. And that probably explains why there seems to be a higher prevalence in women. And then we've got joint hypermobility disorders as well. So things like EDS, other connective tissue disorders, there does seem to be a higher prevalence in those people. In terms of the financial economic burden, so there's like millions and millions of pounds spent every single year dealing with it. And it's probably going into the billions. If you've listened to any of our other podcasts, you know that usually we're talking in the case of billions when we're talking about dysfunctions and problems that require the health service to intervene with. So the costs that are associated with healthcare, and certainly in the UK, are physiotherapy. Obviously, people who are working in surgery, so sometimes it's a surgical intervention, and then dental professionals as well. So that'll be dentists, it could be dental nurses, it could be other dental therapists. The private healthcare costs, things like splints, we have like Botox for things like bruxism as well. And then obviously the surgical interventions, which I mentioned previously, which can be like thousands of pounds if you look at the financial impact on that. The indirect costs are things like lost productivity, and we talk about that on almost every single podcast we do, right? About the presenteeism and absenteeism and how that impacts on the economy, and then the disability impact as well. So chronic TMD sufferers have a lot of pain, and it can really impact on the joy of life. I mean, if you think about a lot of your social activities, they probably are in and around talking, i.e. using your jaw, eating as well, and drinking. So those are the three things that you usually do in a lot of social activities. And if those are things that are aggravating your symptoms, and you've had this for a long time, you can see how that could, lead on to social isolation, people avoiding social activities because they know they're going to pay for it later on. So the symptoms of it: if you get somebody coming in your clinic, you're not a dental professional, you're getting somebody coming to your clinic, what are the things to look out for? Well, it's probably not a surprise that they're going to report jaw pain, and particularly here in and around kind of just in front of the ear, or the tragus if we want to be specific. So between the eye and the ear, this kind of region that people will report it, and it can refer down here into the mandible and over the musculature around here. If you want to get super specific, perhaps over like masseter and over temporal. temporalis as well. So the two big muscle bellies that are associated with mastication. You tend to get people reporting about a clicking, a popping, or a locking of the jaw. So that can sometimes be just part and parcel of TMD. It can suggest something more serious like a disc problem, which can then lead on to needing some surgical intervention. The other things that you'll often hear are headaches and ear pain. So they may actually be coming in to see you about a headache problem, particularly over the lateral aspect of the head. So where temporalis sits, which is kind of over this area here, people might report about pain over this area, and they're coming in to see you about headaches, and that's maybe why they're thinking about acupuncture. You know, on previous podcasts, we've talked about how acupuncture impacts positively for things like migraines. 1 in 7 people experience migraines, so they might actually be coming to see you because of that. And then you kind of go, actually, is there other things going on here? Does your pain come down here? Makes you think about TMD symptoms. So other things that might be functionally impacting, limited mouth opening. So they might talk about difficulty speaking, eating, and yawning as well. So, you know, something that's kind of an involuntary thing, but that can increase pain, or they might not be able to open the mouth as much. Tooth sensitivity and pain. That can be due to the teeth grinding, and then neck and shoulder tension as well. One of the things that can be like a masquerader, if you like, is an upper traps trigger point. So we've got trigger points here that can often happen in our upper traps. And if you look at the pain referral patterns for upper traps, it actually comes over the side of the head and into the bottom part of over your TMD and over your mandible over here as well. So in itself, it's a kind of the other way around here. That's not necessarily causing the trigger point. The trigger point in itself could actually be causing this pain in and around the TMD and over the mandible area. So some of the things that you might hear people say, so that yes, they've got the headaches and yes, the locality of the pain, that you might go on to then ask them about how much jaw opening, yawning, eating, speaking, that kind of stuff. But some other things to listen out for. You might hear things like, my jaw locks when I yawn, or I have to force it back into place. That's pretty extreme, right? The pain radiates up to here or down here. Chewing is exhausting. So they've maybe avoided eating really chewy foods, or they kind of report that as like really something that brings on their symptoms. There's obviously the emotional and social impacts on that. So I talked about, you know, avoiding social situations. There might be a case of like avoiding certain foods. So there could be like a nutritional impact on this. So you might hear things like, you know, their immune system, they kind of pick up on coughs and colds a lot. They maybe look not great because they're not getting great nutrients in them. So they're not getting like a full balanced diet. They might talk about sleep disturbances. So things like bruxism, where people do a lot of clenching and they get splints, that often happens at nighttime. So that can be related to the sleep disturbances, and it's kind of a chicken and egg situation, right? The pain in itself, or the clenching of the jaw might actually cause pain. Or the other way around, the fact that they're not getting enough sleep, they're therefore a little bit more stressed, a bit more cortisol in the system, can then lead to the clenching and then getting the TMD symptoms. There's often a lot of frustration with treatment options as well, because most people want to avoid surgery at all costs, no matter what it is. Whatever problem you got going in your body, most people are thinking, I'd rather not have surgery. And so the conservative management techniques, there's not a lot out there. There's kind of stuff around like exercises and training, but as a physio, I know that exercise adherence is pretty, it's not great, right? And the problem with the exercises is that it can take time to start noticing a difference. So you're talking about several weeks before you can start noticing like small changes to symptoms and particularly pain. So lots of people kind of just like, well, that's not working, and they'll stop before they actually give it a chance. So that in itself can create a lot of frustration and then stress, and then obviously more TMD symptoms. They'll often talk about being worse in the morning after prolonged chewing, talk about the clicking and popping, and then the headaches and stuff we've already mentioned as well. So what we're going to look at here? Well, how does acupuncture work? So as I said earlier, there was a guideline that was released, I think it was 2023, that said that we should be using acupuncture and dry needling for TMD symptoms. And that's because we got a number of randomized controlled trials. We have a scenario where there's not a lot of non-surgical options that have been researched, but the research that has happened in the acupuncture and dry needling context has found to have some benefits. And so the things that we tend to get benefits in with acupuncture studies are reduced pain. That's no surprise, right? We've definitely talked about the pain relieving impact of acupuncture and the mechanisms behind that. So it's probably no surprise that acupuncture works from the pain perspective, but also we know that it influences the mobility perspective as well. So if you have less pain and less sensitivity, you have less of a barrier to movement, and though we know pain in itself can be a barrier to the movement. So if we've removed one of those barriers, people are more likely to be able to move better. If they're able to move and they're moving more often, they're more likely to encourage normal movement, which therefore kind of sends a feedback loop to the brain to go, you know what, this thing isn't not something to worry about. Don't worry about it, all right? And therefore it's not as sensitive. And that's kind of, for me, how acupuncture really fits into this whole picture, is that it's an enabler. It's allowing us to do the other stuff that's really getting the benefits, all right? So if we do acupuncture to help calm down the pain sensitivity or the stimulus sensitivity, they're likely to be able to do more with it. If they can do more with it, that sends a feedback to the brain to go, do you know what? This is nothing to worry about. The brain interprets that as this is not as big a threat, further calming down the pain, and therefore hopefully helping people with their symptoms. So we think that it might impact things like the trigeminal nerve, which comes close to here. It might help reduce some of the hyperactivity of the masticating muscles, so things like masseter and temporalis. Certainly if you're doing like a dry needling type technique, which is really focusing on the muscle belly or the fascia and connective tissue, it could be having an impact there. There could be some scenarios, there have been some RCTs which talk about jaw stiffness and improved mobility. Talk about the mobility part of it, but the stiffness element of it could come from a couple of angles. One could be about reducing the activity of the muscle belly, but the other part of it could be like an anti-inflammatory response. So we know that acupuncture works on the anti-inflammatory network, and so it's not that too stretch of imagination to think, well, if we're putting needles local to the area of a problem, perhaps that's one of the reasons why people report less stiffness and being able to move more, because there's not actually as much swelling around that area. I've talked about the lower trigeminal nerve sensitization, so we're lowering its sensitivity. And it could also help to relieve some things like bruxism. And how it could reduce bruxism, and that, I guess, those stress-related causes, are the fact that we know acupuncture has a big impact on the autonomic nervous system. So again, we've done a previous podcast on that, where we've talked about how acupuncture can really help balance back out the autonomic nervous system and create a bit of harmony. And usually in Western cultures, we're very much swayed towards more sympathetic activity, which kind of tells us that we've got a lot of stress going on. So we know that acupuncture helps to reduce sympathetic activity, i.e. reducing stress. So actually, although we're putting needles local to the area, it might not really be about, or might not be fully about putting needles local to the area, but more about just the fact that we're tapping into the autonomic nervous system and calming things down. They have less stress, therefore they're doing less clenching of their teeth, and therefore they don't get as much TMD symptoms. Right, so what acupuncture points could we do? So for me, there's a couple of options here. If we're thinking that this is predominantly a stress-related problem, I've got two options for you. I've mentioned these on countless occasions. I really hope that this is kind of stressing how good this stuff is. Auricular, so doing the NADA protocol, couple of reasons. One, the trigeminal nerve comes over the ear, okay? So you're very close to one of the structures that we think causes pain and sensitivity. The ear, basically the nerve goes over that area, right? The second reason, which I think perhaps more likely, is the fact that if we needle the ear, we are reducing sympathetic activity by increasing parasympathetic activity. Remember, we've talked about this kind of seesaw effect in the past. So we're increasing parasympathetic activity by needling the ear, and therefore people will feel more relaxed, they'll feel more chilled. So if you're kind of thinking, the reason it feels like the root cause of their TMD symptoms is stress and anxiety, I'd be inclined to go with something like the NADA protocol on the ear, or I could go with something like 4 Gates. 4 Gates is kind of that just overarching body, lovely one, large intestine 4, liver 3, really helps to calm and relax people out. If I was wanting to do a more targeted approach, so I was wanting to be a lot more specific to the area, we've got a few points that I'd really recommend. Stomach 6, Stomach 7, which is here where your condylar process comes into. I'm definitely going to be putting those in. Then maybe he's going to go with a Tai Yang, which kind of comes here at the outer canthus of your eye. So we've got these 3 points here that are kind of like, for me, I'd definitely use. Then we've got 3 points that we do just in front of the tragus. So just here in front of the tragus, we'll have 3 points on the gallbladder, small intestine, and triple energizer meridians. And they all kind of just sit one above each other in front of the tragus. And we do something called through-point needling. So we have a needle that's parallel to the side of the face, and we're just going to thread that needle in nice and slowly down like that. And so what you end up having is effectively six acupuncture points stimulated, 3 of them through one needle here, another one here, another one here, and another one here. So you kind of got like a really good targeted approach on here. And then I'm going to go with something like large intestine 4 as a distal point. You could go with the triple energizer 5, but large intestine 4 for me is a big one because TMD symptoms do tend to be on the higher intense pain intensity scale. And we know that large intestine 4 in TCM scenarios is quoted for severe and acute pain. So this for me would be me distal point. I'd lovely combining in there. If you were finding that there was a lot of symptoms that were kind of radiating beyond the ear and behind the ear, you've got things like triple energizer 17, you've got An-Mien, which kind of just sits in here behind the ear. You could even go more posterior. So you could go here, a gallbladder 20. That could be another option, certainly if people were kind of reporting the pain to coming along further behind the ear, which could happen in more severe cases. If I was thinking it could be related to a trigger point, obviously I'm going to be needling gallbladder 21 because gallbladder 21 really sits over that trigger point in there. So, if you've just done an assessment, you found a trigger point in here and that reproduces their symptoms, put gallbladder 21 in. If we want to add in like some TCM elements in here, gallbladder 34, so yeah, that's on your leg and it's just in front of your fibular head, but that talks a lot about soft tissue injuries, so that would be a really nice one to add in there. Certainly if you think it's kind of like about like an overactivity of things like masseter and temporalis. And then what you're probably not surprised is we'll go with some kind of ashy or dry needling type approaches where we're putting needles directly into the muscle bellies of masseter and temporalis as well. We've got to be really careful when we're needling masseter and temporalis because faces do tend to bleed. So we don't want to do any kind of vigorous needling techniques just because it's very likely to bleed and bruise and doesn't look great, right? And they can also be very sensitive. But yeah, I found that you'll find like trigger points in an area, loads of tender spots within masseter and within temporalis. So I could combine those in with the standard acupuncture points as well. Yeah, there's a couple of studies I'm kind of looking on here. There's a couple of studies that talk about maybe using Governor 20 in the top of the head. It's not really something that I've used a lot. TMD tends to be kind of localized to the lateral part. I can't really see a lot of rationale for putting in Governor 20 personally, but there are people out there that would do it. So hopefully that has been helpful. I hope that has been some insightful takes on what TMD is. There is definitely an evidence base to support acupuncture for TMD. There are national guidelines here in the UK that say that dental professionals and those who are dealing with facial pain should be including acupuncture and dry needling as part of their day-to-day care. So we've got some really strong research evidence-based backing behind this. In terms of how many people it affects, it's not as prevalent as some of the other things that we've covered on these podcasts, but nevertheless, it does affect people. And because of that kind of that social activity, and maybe this is just me, right? But my social activities usually include a lot of talking, a lot of eating, and a lot of drinking, all right? So if you can't take any joy from those 3 things, you can see the psychosocial impact that this might have on people just on their day-to-day lives. And then I'll give you some ideas on what you can maybe look at doing. So if you've been doing foundation acupuncture training, a lot of these points you'll have done. If you've done any of our facial head, neck, and headaches course, you'll recognize these points as well. So basically those collection of stomach points, Tai Yang, and those points that sit in front of the tragus combined with a large intestine 4. If you were thinking it was more stress related, I would do something just simple like the NADA protocol or 4 gates. And if I thought there was more of a musculoskeletal element to it, I'd be looking at things like gallbladder 21 over upper traps, temporalis and masseter dry needling techniques, and a cheeky little gallbladder 34 in the leg. So I hope you've enjoyed. And as I say after every time, please like, comment, and share. It makes a massive difference. The fact that I say this on the end of every single podcast, hopefully that is really driving home the importance to this, right? I want to know if this is any good, right? We've put a lot of time into this and we really want to make this a helpful resource for those of you who are either practicing acupuncture and dry needling or wanting to know a bit more about it either as a patient and you're thinking about getting this done yourself, or as a professional and you're thinking, do I want to add this string to me bow or me tool to me toolbox? So the like, comments and shares make a huge difference. Would love to hear from you, and I'll see you in the next episode.